And we are recording, go for it.
All right, I'm logged into Care Connect. I'm going to click on this schedule right here, the multi-provider schedule. The reason why providers like this view is because they can customize this view.
Okay.
Okay. I'm going to go ahead and call up my reports here down at the bottom of the screen. 2 reports that providers do like to add. I'm going to click on this wrench right here. Anytime you see a wrench within Care Connect, you can customize. 2 reports that providers do like to add is the relevant info, and the other report is the TXP patient summary report.
Gotcha.
So now those 2 reports are now added on the toolbar right here. So any patient that you single click, that makes this information display right here on the report. So I single clicked on Harold. Snapshot gives you an overview of that particular patient. Rooming report, what displays there. You can see the information that your nurse has entered into the computer. Reason for visit and the vitals. Relevant info, 2 years worth of labs will display there. So let me scroll down. 2 years worth of labs. So you click on the detail hyperlink over on the right hand side, and it also displays 4 years worth of relevant encounters. So I'm not in the chart, I'm not in the encounter, these are nice reports. That's a hyperlink I can click on and view that information. TXP patient summary, it trends the blood pressures and the weights. And if your patient was admitted to RGH or Newark, that would also display on this report with a hyperlink, and it displays the ED, discharge summary, plus other helpful information that will display there. So one thing that you have to be very careful of a patient that's on the multi-provider schedule is take notice of this status column right here. If the patient is scheduled, please make sure you do not double click on that particular patient. If you need to review the patient's chart, just review information from these reports right here. And if you need to review information in the patient's chart, click on this chart button right here. That just opens up the chart and does not open up the encounter.
Makes sense.
What's that?
Makes sense.
Perfect. I'm just going to go ahead and exit the workspace by clicking the X on that tab, brings you right back to the schedule. In our training environment, the green dot means that the provider can go into the exam room to see that particular patient. So Harold, I'm going to double click on Harold. I'm now into the encounter. Sometimes you're presented with best practice advisories. The ones that appear in your face are regulatory ones. So the best thing to do to deal with the best practice advisory is read what's in the yellow banner. It will give you acknowledged reasons, orders, or buttons to satisfy that. I could click on dismiss the next time I open up that encounter. The BPA will display. However, I have a treatment in place. I'm just going to acknowledge that, and I'm going to click on accept. So always make sure that as you're documenting, you are documenting on the correct patient. So I'm going to look at the tab. Here's Harold. I'm looking at the information in that patient header. I'm just going to click out of that pop-up window. So you have the widescreen view. The default is the rooming. These are the tasks that are performed during that rooming process, kind of like what your nurses have entered in. So how it works is you have a horizontal table of contents. This is the information that has been entered in during the rooming process. You can see the chief complaint, what has been entered in. And you can scroll or you can click on these buttons in order to open up.
Gotcha.
Now, I'm just going to scroll down to review the information. I also have a scroll bar over here on the right-hand side. So I can see the vitals that have been entered in. If I need to enter in a new set of vitals, all I have to do is click on that button that says new set of vitals. Allergies, every patient, every time. Review the allergies. If I need to add an allergy, all I have to do is click on allergies right there in order to open it up.
So this is the first time. This is going to take the staff a lot longer.
It probably will, being the first time that they're utilizing Care Connect. It will take them longer to room a patient because they're not
They got to
used
enter all information.
Right, exactly. If the patient has been seen in Care Connect before, All of this information
Should be
is
there.
in there, right, exactly. But if nothing has been preloaded in there,
It's all brand new for them.
if it's
Good.
all new, then there's not going to be anything that's going to be there, so they're going to
No
have to
problem.
manually enter that information in. And we do have like outside sources that helps them add this information as well. So like when patients check in, and if they sign like a Rio consent form, it will tell them we have new information from an outside source. It's like a
Okay.
hyperlink that they can click on, and they can add that information without them manually searching for
Okay.
that stuff. But if I wanted to add, like this particular person is allergic to like penicillin, I click on allergies, notice that it opened it up. Now I have a window right here. I can actually search for whatever allergy it is that I
Sounds
need
good.
to enter in. Stop sign required. If I'm unsure what it's looking for, I click on the magnifying glass, and I'm searching for
Whatever diagnosis.
It-
Yeah, this is
So I'm
all
just-
simple.
Yep, I'm just searching. I can add a comment here,
Ooh,
accept.
hate
Oh,
that.
you like my comment?
Yeah, look Swedish.
Yeah, exactly.
Finnish.
So this yellow banner triggers off that severity of high.
Gotcha.
Yeah.
Good.
If I need to delete something, I click on this hyperlink, it opens up B, and I can go ahead and delete an allergy
Sounds
if
good.
needed be. Every patient, every time, I review the allergy. By clicking that button, this is marked as
Market
reviewed.
review. Good.
Yeah. Here's the medications. I can see what medication that my nurse marked as taking. Okay, so I can see that right from there. This is where I'm reconciling all of the medications. So I'm just reviewing this information.
Yep.
If I need to
Then mark
discon-
as, if you had to add new medication, you can.
Yep, that's
When you're
exactly
done,
right.
mark as review.
Right, so if I needed to update it, I needed to click on medication in order to open up that section.
Good.
That's exactly right. If I needed to put an over-counter medication, I needed to open it up and add medications right
Sounds
here.
good.
If I needed to discontinue, I hover over medication, and I can bring my mouse
Yes.
way over here on
Good.
the right-hand side and discontinue a med. Mark it as reviewed.
Good.
Yep, exactly. Here's my history. I can see everything that's right here as a preview. If I need to update, add to it, I click on history, it opens up, and I can add to the history.
Good.
Yeah, exactly. Okay. Here's my marked as reviewed button right here from the preview pane. This marks everything as being reviewed as well.
Good.
Yep, and that satisfies the tobacco use as
Gotcha.
well. Yep. Plan. So the plan is your problem list, your visit diagnosis, and this is where you're placing all of your orders as well. So if you start here, I can click on the words problem list, and it drops me right here to the problem list.
Sounds good.
Right here, yep. Or I could scroll, whatever works best. Mark your problem list as reviewed as well.
Good.
Okay. So if you start at your problem list, you can add your diagnosis codes down to your visit diagnosis for today. So if I have hypertension on the problem list and I want to push it down, this sheet of paper with the blue arrow, and you can hover over any button and it kind of tells you what it is.
Sounds good.
Yep. So we can keep diagnosis generic on the problem list. As soon as we're using it for billing, we have to select other buttons as
Gotcha.
well. Perfect. Yep, then if you want to add a diagnosis code, I can just type right here. And then if I want to push a diagnosis code to a serious chronic problem, that's where that sheet of paper,
Got it.
push it up to the problem list. Perfect. Yep, you're just utilizing those tools and whatnot. So if you start there, work here, so by the time you come over here to your meds and orders and you place any orders, when you go and you associate them, all your visit diagnoses will be there in a grid for you.
Good.
So individually search for an order if you want, just by typing in that field, that search field. Or if you prefer to click from a list, all you have to do is click on new order right here.
Fine.
Okay? That's called the department preference list. Keep in mind, if you always order the exact same thing, you can create yourself a personal preference list.
Okay.
Okay? So you're not clicking and scrolling, trying to find whatever order it is that you normally order.
Okay.
Okay? Whenever you place an order, sometimes they might have stop signs that you have to select. So you call up all of your orders, and every order, including a med, has to be associated with a diagnosis code.
Gotcha.
Okay? If you're prescribing any medication, these are the medications that this particular person is on. Or if you're prescribing like an antibiotic, a new med, best way to go